Well, good afternoon to everybody. My name is Priscilla Andrews, and thank you for joining us at the Cancer Wellness Center's staff chat for April. In case you don't know who I am, I'm the clinical manager here at the Cancer Wellness Center. And back when COVID first started, we created the staff chat series as a way to give the participants of the cancer community in our area some insight into a conversation between professionals talking about issues and concerns that are relevant to people living with a cancer diagnosis. And I am very pleased today to have with me joining me today, Brandon Buchanan. Hi, Brandon. Brandon is joining us from NorthShore University HealthSystem, where he serves as the Director of Health Equity, which we'll be talking about today, talking about barriers in healthcare and talking more about what exactly is health equity and what are the efforts being made to better achieve health equity. Just a little bit about Brandon. I was very interested to read your bio, actually, Brandon, because it said he is a writer, a mentor, and a community health advocate. So you're like the trifecta there. So in his role, he helps to promote the vision of health equity and develop interventions to eliminate health disparities. He's also a critical leader in NorthShore's Black Leadership Forum and has been instrumental in advancing key efforts to expand perspectives across the organization. So thank you so much for being here with us today, Brandon.
And happy to be here. Thanks, Priscilla. Looking forward to our discussion today.
Yeah. When I sit down with people, the first thing I always like to just find out a little bit more about is, what drew you to the work that you're in? I'm curious, what about health disparities got you into the position and is keeping you there?
That's a great question. I started my career working at a federally qualified health center in Southern Illinois during college, and usually FQHCs, their target population, they focus on minority and underserved and low-income patients. And so from a very early age and young age, I have specifically chosen to work with folks who look like me in the communities that represent me, and even have navigated the last probably decade or so of working in various public health roles, advocating for folks who may not be able to advocate for themselves. And so what continues to keep me in this role and keeps me fueled and passionate about the work that I do is being a voice for folks who may not be able to be a voice for themselves.
Yeah. I mean, I love hearing the background from people because the work I do feels very personally inspired for me, and I can hear that come through for you as well. And just for a frame of reference, would the Cook County Health System, like Stroger, would that be like an equivalent when you say an FQ, federally qualified health center?
So an FQHC. So I don't know if Cook County specifically is an FQHC, but they are a county or a state program, but they typically serve low-income, uninsured patients, and so similar model, but similar model.
Okay, just as a frame of reference for people who may not know the acronym language here. So, I mean, I think to start out with, I think helpful to just talk about what we mean when we say certain words. I know, like you and I talked before we met today. And so when people hear the terms health equity, or, I think we talk a lot more in the last couple of years, have been talking more about diversity. When we hear those terms, what does that mean from your perspective?
Great question. So let's start with diversity. Diversity is essentially acknowledging that we all come from different backgrounds. And so a lot of folks will assume that diversity is just referring to race or ethnicity, what's your skin color. But diversity can apply to your education level, your income level, your religious beliefs. And so acknowledging that we are all from different backgrounds and different ways of life, that's diversity. And then there's this term called inclusion, which is about acknowledging and accepting all of those differences and bringing folks to the table and giving a voice. And then when we think about health equity is acknowledging those differences, so differences in race, ethnicity, language, maybe sexual orientation and gender identity, and recognizing that based on those factors, we each may have different health outcomes in terms of incidence or rate of disease and or just our ability to, or just overall looking at our outcomes for achieving optimal health. So just to rephrase that in another way, health equity is just ensuring that all of our different our populations and how we're defined, that we achieve, that those individuals are achieving optimal health outcomes. I heard an interesting way to view kind of diversity and inclusion, maybe even equity in this way, and it's saying diversity is being invited to the party, inclusion is being asked to dance, and equity is having your preferred music played. So
I love that.
Yeah, that helps me like really frame how to approach this.
Yeah, and I think it speaks to the fact that there are different depths, and I would imagine in healthcare, like just getting the invitation to the party is not the same as feeling included or a part of the community once you're there.
Absolutely.
Yeah, and I'm curious. What came to my mind as you were talking about this is just thinking about, I think something I've noticed myself is shifting away from the language of equality and talking more about equity. And I'm wondering if you could speak a little bit about the difference between those two terms, if you feel like there's a difference between those two terms, and if so, the importance or the value of the shift to talking about equity versus equality. I mean, maybe I see them as a little bit different, but I'm curious about your take.
Absolutely, there's a difference. Equality is giving everyone the same tools and resources and or tools and resources, I should say, rather, that they need. Equity is giving an individual the level of resources or the amount of tools that they need based on, those different buckets of diversity that we talked about.
Yeah.
You've probably have you seen the picture where the kiddos are looking over the fence and everyone's standing on a box? And you have a short kid standing on a box and a tall kid standing on a box. Well, maybe the taller kid doesn't need a box, and maybe the shorter kid needs two boxes to stand on to reach the apple or the tree. So I hope that provides some clarity. Yeah,
I mean, I think thinking about the fact that if we just think about everybody's going to get the same exact resource, that's not going to take into account that one kid needs a little bit bigger box to peek over the fence than the other person. So even though the outcome is not going to, even if the effort is to get people the box, the outcome is not going to be achieved.
Right, and I would even say, let's remove the fence in the first place. Think about the term that we talked about of inclusion, right? How are we creating pathways for communities, in my case, for patients, to achieve their most optimal and just outcome?
Yeah. And that seems like that's part of the equity piece, is not just concerning yourself about what size box people get, but also taking a look at what is that fence that's getting in the way of just being able to see what's on the other side of the fence, metaphorically speaking.
Yeah, absolutely. Like, what are those barriers that are preventing patients from achieving their optimal health outcome?
Do you feel like within the health sphere, just staying with the metaphor for a second, do you feel, is it kind of a yes and focus of we're looking at the fence and we're looking at the size of the box? Or do you find in healthcare you focus on more one than the other? Like, are you looking at what the barriers are, or is it also sort of thinking about what do each unique person or each unique community need by way of resources?
It's both, right? And so we have to first acknowledge and understand, hey, what's preventing someone, a patient, let's say, for the same metaphor, from achieving their optimal health outcome? Is that related to where they live? Is it related to their income level? Is it related to historical conditions or systematic conditions? And then we have to take it a step further and say, well, what's our role in that? What's our role as a country, as or an organization, as NorthShore University HealthSystem, in preventing our patients, our community members from achieving those outcomes? So it's a yes and.
Yeah. And I when you talked about that systemic piece, I mean, I think it just makes me think about the fact that, like, maybe we want to look at like just what's going on in the present, but it feels to me like if we just do that, then we overlook everything that's gotten us to where we are now, that is influencing the circumstances that people find themselves in, that are creating those barriers, if that makes any sense.
It does make sense. And I think if we approach it from the lens of our patient populations, and again, I have my health equity hat on.
Yeah, please.
Of NorthShore, but if we approach
that's why you're here, so thank you for doing that.
but if we approach it from the perspective of, well, how has that history influenced our patient perspective? How has that history influenced their level of trust or lack thereof with our organization, with seeking healthcare services? How has that history influenced our providers, our team members? And so, it's important to also acknowledge kind of where we've been and the historical components, but also the role that it plays within our internal team members and consumers, and then our external, right, our patients, our community members.
Yeah. Well, and it makes me think, it seems to me like COVID, I think, has shown a light on so many things. And when you were talking, that sort of brought that to light of, like, I think some of the hesitancy, my sense, the hesitancy within the Black community to be vaccinated, like there being some healthy paranoia there based on historical experiences that community has had. I mean, Tuskegee, I think, being a big one, that, like, to overlook that may be what is contributing to now today. I could see that limiting how you're able to think about, like, how do we start to gain people's trust so that they are willing to move forward with some of these health initiatives, if you will.
Yeah, so there are federal examples like the one that you just mentioned, the Tuskegee challenge, where folks were injected. I'm not using the correct vernacular, but there was with syphilis, and then weren't kind of towed down the line and given a proper medical treatment. So there's some historical fear, mistrust at the kind of federal level, right?
Yeah.
And then also thinking about at the local level, with interacting and connecting with and treating patients from minority and underrepresented groups. And what role have we, and I'm saying we as NorthShore, as an organization, played in that mistrust and that fear? And how can we work to repair that and move forward? And so just acknowledging that there are multiple layers in terms of what may contribute to mistrust and fear among the communities that we serve.
I mean, it sounds like from what you're saying that like your role at NorthShore, if I can extrapolate from what you said accurately, like part of this is really a process of NorthShore. I mean, you're from NorthShore, but I would imagine there's similar efforts in other healthcare systems of really, part of it is about looking within, not just looking at the fence, but also looking within to say, okay, like, how did that fence get built? What are we doing that created that fence?
Absolutely, and you articulated that so well. And some of that is looking within to say, how are we training our providers, our team members around the various biases or implicit biases that they have? How are we supporting and enhancing recruitment of diverse providers and team members to represent the communities that we're serving? And so absolutely, there's a bit of a, hey, we're putting the mirror up, and we've acknowledged that there are some areas that we can and do better with. And I think we've done a great job in the last several years of really dismantling that fence, back to our original analogy.
Progress is possible. Yes.
It's a journey for sure.
It's a journey. We're not there yet. It's always in process. Progress is a process. And you used a term there that I kind of wanted to check in with, of implicit bias. I mean, I think sometimes we hear that term without people may not even realize what that's referring to. So could you speak a little to that?
Sure. So let's break it down a little bit. So like implicit basically means you're doing something automatically. It's ingrained. It's unknown. It's like in your subconscious or unconscious. And then bias, right, is just any type of negative belief or action that you or I may hold. And so when you put those two together, it's, hey, I'm unconsciously or automatically making some type of judgment. And that may be because of the way that I grew up. It may be because of my socioeconomic status. It could be because of what I'm hearing and have been trained to hear in the news and on the media, and it just becomes a part or a way of life. And so when we think about just implicit bias as it relates to healthcare, it's an example may be a physician may have an implicit bias about a Black patient that she is treating for XYZ issue, and may say, it may unconsciously make a decision or plan in that treatment based on a preconceived notion that individual or physician has come to believe about her patient that she's treating.
Yeah. I mean,
go ahead.
Oh, no. Well, I was just going to say, I mean, it just calls to mind a client I had once who was ESL, and in her country of origin, she had trained as a medical professional and often came in talking about the frustration she had with the doctors, feeling like she was being talked down to, feeling like, they were kind of giving her really short answers, kind of underestimating what her knowledge base was based on the fact that she was an immigrant, that she had an accent, that really impacted her experience of the care that she received, and probably limited her ability to partner with her healthcare team on healthcare decisions.
Absolutely. And so just to clarify, ESL for those English as a second language, right?
Yeah, sorry. Thank you.
That's an example of an implicit bias or bias that that patient experienced just based on a preconceived notion that, if English isn't your first language, perhaps this person doesn't know or won't be able to comprehend the treatment plan, and are a little bit unbeknownst to them that this person studied medicine and has you know what I mean? And so, so as we think about like ways and how can we dismantle that? How can we go remove that fence? It's bringing awareness to implicit biases. Like I have implicit biases, you have implicit bias, and it's not necessarily, it's acknowledging that, but then also how can we do and be better moving forward, and how can we bring awareness, whether that's through training and education and learning platforms and modalities. So just something to think about.
I mean, it seems like the takeaway for me is, how do we move away from not just making assumptions about people? And especially when those assumptions can have negative consequences or be negative in nature. I mean, it seems like it's implicit bias. We're not even thinking about it. It's ingrained in us, and yet we assume that we know something about person, or we assume how they'll respond to something. I mean, is that on the right? Am I in the?
Yeah, absolutely. And I would say how do we get past that? And something that I've just found that's been helpful is to kind of challenge those assumptions, ask questions. There's a commercial, I saw it a couple of weeks ago, and it's about a judge. You don't know that this gentleman is a judge until the end of the commercial, and he's walking through and living his daily and normal life, and he's experiencing so many different kind of challenges and biases and looks. But at the end of the commercial, you find out that this young man is a distinguished judge, and you just wouldn't know that by looking at him. And so one way to challenge that is to ask a question and to learn and extend the olive branch and to get to know somebody outside of your normal sphere and circle, right?
Sure. And I will just comment to say, like, it seems like there's so many different ways in which implicit bias can have a negative impact on somebody's experience with a healthcare team, whether it be, based on, what kind of treatment or options maybe they're provided, or something that's like really like concrete, to just thinking about like the client that I mentioned, like the quality of the relationship that they have with their doctor that impedes the relationship that she has with her healthcare team.
Sure, and so many different entry points, whether you are checking in for an appointment and you're interacting with one of our registrars or frontline team members, whether you are getting your blood pressure taken by a medical assistant, or whether you are interacting directly with your care provider, if that's a physician or a nurse practitioner. There are so many different touch points when someone comes to one of our facilities, and many just in healthcare, period. And so a patient can experience implicit bias or at any point in their journey in the healthcare system. I think that's the point I was trying to make.
Yeah. So I want to just shift our focus to the idea of health equity and health inequity, like when there are disparities. And, how do you go about determining if something there is a health disparity, and how do you decide which of the health outcomes need to be addressed?
Great question. One of our approaches, and I think not a lot, but I want to say best practice in this work is looking at patient data and stratifying those data by different metrics. So by race, ethnicity, and language preference, and sometimes even disability status, sexual orientation, and gender identity, but really starting at a fundamental level of looking at outcomes. Healthcare organizations, NorthShore included, we do a phenomenal job of tracking data and measuring outcomes, right? We're in the business of making people better, right? And so, of course, we track that. We track quality and safety. We track experience metrics. And so that's the key and fundamental step of looking at those data by race, ethnicity, and language preference. And then determining, once you stratify those data, you may notice that, it's interesting. And I'm making this up, why are women more likely to get XYZ screening compared to men? Or why does this demographic tend to get a COVID vaccination compared to another demographic? And so you ask the question around, how do you determine which inequity to tackle and which inequity to start with, right? Because frankly, we can't boil the ocean, or as someone else said it, how do you eat an elephant one bite at a time? Yeah. And so you start with the metrics or the outcomes that have been identified as high priority within your organization, and we've done that here at NorthShore. And so we are slowly making incremental steps to address health equity and health inequity and disparity.
I have to imagine you got to keep your eyes focused on the fork and not the elephant, or else you could easily get overwhelmed there.
Right, exactly. And honestly, it can be challenging because that elephant is 1,000 pounds and is huge.
Yeah.
But sometimes it's helpful to reflect, at least in my experiences, of looking back and say, wow, we've accomplished a lot.
Yeah.
Yeah.
Well, and it seems like one of the important elements of this too is, can we also just, at least as a starting point, can we acknowledge that there is an elephant in the room?
Thank you. Let's have that conversation, right? Like, acknowledge that there's this elephant, and how do we tackle that elephant, right?
Yeah, we're not going to just keep sidestepping it. Hopefully. Um, so, I want to talk about North Shore specifically as well, but I'm curious, like more broadly, what can we do as a society to achieve health equity, and even thinking on an individual basis, what people as individuals can do to support efforts to break down barriers and create an environment of higher equity. Is that even possible? I mean, I don't even know. So
yeah, that's a great question. I think the first point is, from a societal standpoint, there's some systematic and policy changes that can be done and to support improving health equity. And again, from a healthcare perspective, that's having our insurance providers hold health systems like NorthShore accountable for making sure every patient population has equitable outcomes. So just because you make more money doesn't mean that you should have higher health outcomes compared to someone who may not make as much money. And so there are things like that in terms of at the policy and system level that can happen. At an individual level, I think I don't know if I have a great answer for that. I think having conversations and dialogues like the one that we're having today, learning and educating yourself, but also participating in organizations that have a focus on equity and improving outcomes, whether it's tied to the community and your surrounding community, if there's something that you can do as an individual to continue to advocate on behalf of those who may be less fortunate or from underrepresented or minority groups. So that's an opportunity there from an individual level, is education, learn, ask questions, but then partner with organizations and donate to organizations that advance this work.
Well, and it seems like piggybacking on the more systemic or the more societal level, being aware of what policies that are related to health equity, and it seems like whether it be political action or political spending, of being aware of what these policies are and why they're important, and using your vote or your voice to help promote and support those policies.
That's absolutely one way to continue to get involved in the support, particularly from an individual level, supporting kind of local and federal government and policies and voting.
Yeah. So, I mean, we kind of talked in broad terms about examples of health equities. What about within the cancer community? Are you aware of health equity and health disparities, whether it be more broadly or within the North Shore community, that you're recognizing need to be addressed?
Absolutely. And as I just think about this, COVID-19 has uncovered and exacerbated some of those inequities, particularly around the screening and prevention side. So, for instance, in our North Shore community, and I'm thinking parts of Lake County, parts of Cook County, we've seen just lower screening screening rates in colorectal cancer screening, breast cancer screening, and cervical cancer screening rates. And that could be due to a multitude of factors, right? Folks may have lost their jobs during the pandemic and may not have insurance. So that's probably one of the factors. There may be transportation issues related to not being able to seek and kind of get these screenings. But then there's also, like, as we think about just inequity, the term inequity, and again, thinking back to kind of what that means, there are inequities in cancer prevalence and incidence rates depending on your race or ethnicity. So if you're Black or African American or Hispanic Latino, there are disparities in your income level and kind of incidence and prevalence and things like that. So that's maybe one example of what can be seen across the cancer community.
And I want to make sure I'm kind of conceptualizing this accurately, because like going back to that idea of, I love that image of the two kids on the fence in the boxes. I've not heard that before, but like thinking about, if there's a higher incidence of a particular type of cancer in a particular community, let's say within the Black community, there's a higher incidence of multiple myeloma, for instance. If we just are equal about everything, that's not going to address the fact that there's a higher incidence of multiple myeloma in that community, and that may need, for it to be equitable, that may need more attention because there is that higher prevalence. Is that?
Sure, and I guess what I would say is, what role do we play as a health system? Right, and how do we partner with local organizations and federal organizations to address that? So it could be genetic, it could be where individuals in that community that you use in the example live. It could be a multitude of things. There's this concept called social determinants of health, where kind of factors outside of genetic and like where you live, access to clean water, grocery stores, parks to play in, where 80% of those factors make up like your overall optimal health, whereas like 20% of that is just related to genetics. And so what role can we play as a healthcare system and organization in partnering with other organizations and policymakers to shed light and turn that mirror to say, hey, how can we help this community? How can we do and be better for those that we're serving?
Well, and it sounds like too, like part of it is speaking to the idea of not just how do we treat these things once they occur, but trying to get more at the root of how do we try to reduce the fact that they're recurring in disproportionate numbers.
Absolutely. And I just thought about something that we kind of haven't talked about, but it's more around like workforce development, just shifting gears for a second.
No.
So how are we using that same approach, how are we educating our young adults, our kiddos, and letting them know about careers in healthcare, to say, hey, we are starting at the beginning stages, early ages, to provide and shed light about the opportunities that exist in healthcare. And so think about that, but then going back to your point around prevention and education. And yeah, we do a great job as a healthcare system of taking care of people, but how can we keep folks out of the hospital? How can we partner with primary care physicians and other organizations around this preventative medicine and keeping folks healthier in our communities?
I mean, it speaks to the fact that there is the like short-term goals, I would imagine, that you guys set as a healthcare system, but then also there being these like longer term goals that just can't be realized like the goal could be that we're implementing this, but seeing the outcome in health may take longer to see if we're trying to shift things as far as, you know, if I think about like access to care, or not access to care, but like you gave some of the examples of like environmental factors that could theoretically need to be addressed in order to achieve higher health equity. And it seems to me like some of those things, like they're just going to take time and like continued effort, and not keep taking your eye off the ball in order to implement them alongside of the things that give a little bit more immediate outcome. I'm fumbling here. Am I?
Yeah, absolutely. But then I would add as well that it's coming together with other hospital systems, coming together with our public health department, with community organizations to truly tackle the health and well-being of our broader community, right? And so how are we forming those partnerships and relationships and investing into our community to support achieving optimal health outcomes?
And we've kind of talked in broad strokes about this, but I'd be curious to hear what initiatives NorthShore has underway. It seems like there's the component that's sort of in-house. What are we doing within? And then also, how are we looking outside of ourselves to our stakeholders in the community? So curious to hear where NorthShore is turning its attention right now.
Great question. And yeah, I like how you segment it into kind of internal and external. So we as an organization have been on a journey for the last 2.5 years in terms of looking at and prioritizing how we accelerate diversity, equity, and inclusion. And so we have made a bold commitment to our team members, to our patients, and to our community members to advance and accelerate inclusion. So creating an environment where folks can truly be their authentic self. And how do we amplify the voices of our diverse team members through different groups? You mentioned the Black Leadership Forum, and so that's one opportunity, right? Through opportunity is another area that we've highlighted in terms of how are we developing and creating pathways for learners and students and and our own team members. And then finally, we've made a commitment to advance and accelerate health equity. And so that's my role and my job. And we are looking at how we collect patient data. So about 20% of our patients are categorized as other. So that means we are working to improve how we collect those data. We've identified some health disparities in breast cancer screening rates among our low-income patient population. And so there's a lot of work and effort around there. And then we've identified a disparity in terms of our patient experience. So when you're discharged from a hospital, from one of our hospitals, as our mini hospitals, patients receive a survey that says, hey, how was our physician communication? How was our cleanliness? How well managed was your pain? And so we found a disparity in response rates between our minority and our non-minority patients. And so those are some of the things that we're working on internally around inclusion, team member focus, opportunity, creating pathways, and then health equity, identifying and working through those disparities. And then I'll shift gears for a second and talk about one initiative that we are working on within our broader communities as NorthShore Edward Elmhurst, and that's through our Community Investment Fund, where we have, as an organization, have made a bold commitment to invest $100 million into our broader communities that we're serving through strategic partnerships with the focus on community organizations that support improving the health and well-being through health equity and social determinants of health, but also economic well-being and viability. And so we just several months ago launched our inaugural Community Investment Fund, where we awarded $2.6 million to 7 community partners across our Cook and Lake County service areas everything from domestic violence to
Mm.
food insecurity to a mobile outreach clinic in Van. And so we are actively taking a role as NorthShore University HealthSystem in our communities to build
Yeah.
those partnerships to advance health equity and well-being.
You're putting your money where your mouth is.
Well said. Absolutely.
Well, I want to be mindful of time because I see our time together is winding down. I'm always surprised at how quickly 45 minutes can go by.
Right.
Want to give you the last word as we're closing up. Any other reflections you'd like to share around NorthShore, around the topic we've been talking about here, Brandon?
Yeah, Priscilla, first of all, thank you for this opportunity to provide a lens in what we're doing here at NorthShore. And I will say that this has and continues to be a journey for our organization. And it's something that I've been at NorthShore almost 4 years. It'll be 4 years in the next couple of weeks.
Happy anniversary.
Thank you. I've truly felt connected to the work that I'm doing, and I feel blessed to be a part of such an amazing team of colleagues and peers, both physicians and non-physicians who are truly passionate about the work that we're doing, and just recognizing that it's not always a linear journey towards achieving health outcomes. Like, this is literally the work of a lifetime and the work that will last generations. And it's an honor and a privilege to be a part of a team that is paving the road for a new generation of healthcare workers, of patients, of community members to come. So thank you again for this opportunity to chat this afternoon.
Yeah, thank you so much for joining me, Brandon. And I just love hearing your passion. I think when we can do work that we feel passionate about, it's the most meaningful. So thank you for being here with me this month. And thank you, those of you in our viewing audience here with me today, or who may be joining us on our YouTube channel. I don't know if you'll be back here next month, but I will be back here. I'm looking at my calendar. I'll be back here next month on May 11th at 12:15, where I'll be joined by my colleagues, Kimberly Matthews and Zoe Goldenstein, where we'll be talking about women in under 50 and cancer. Thanks again, Brandon.
Thank you.
Have a good afternoon.